Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Immunological medications. A client is admitted to the emergency room, complaints of a difficulty of breathing, and upon auscultation, the nurse noted that the patient has wheezes. An allergic reaction to penicillin was diagnosed. Which of the following medications should the nurse expect to administer first? Option A. Aminophylline, theophylline. Option B. Albuterol, Ventolin HFA. Option C. Methylprednisolone, Solumedrol. Option D. Pulmicort, budesonide. Right answer is Option B. Albuterol, Ventolin HFA. Albuterol, Ventolin HFA, is the most rapidly acting of the medications among the choices. Option A is not the first-line treatment for a bronchospasm. Option C and D are corticosteroids that are used during allergic reaction but are not rapidly acting. The nurse is assigned to care for a client with cytomegalovirus, retinitis, and acquired immunodeficiency syndrome who is receiving foscarnet, Foscavir. The nurse carefully monitors which of the following laboratory tests during the treatment with this medication, except Option A. Serum creatinine. Option B. Serum calcium. Option C. Serum magnesium. Option D. Serum sodium. Right answer is Option C. Serum magnesium. Renal impairment is the major toxicity involved in foscarnet, Foscavir. This medicine also may cause decreased levels of calcium, magnesium, phosphorus, and potassium. A client is recently diagnosed with HIV and a highly anti-retroviral therapy is started. After the first week of therapy, the patient complains of headaches, dizziness, and nightmares. Which one of the following antiretroviral drugs is most likely associated with these symptoms? Option A. Lamivudine. Option B. Efavirenz. Option C. Tenofovir. Option D. Saquinavir. Right answer is Option B. Efavirenz. Efavirenz is a non-nucleoside reverse transcriptase inhibitor. Side effects include rash, dizziness, confusion, headache, and nightmares. Options A and C. Lamivudine and tenofovir. Side effects includes headache, dizziness, nausea, diarrhea, or trouble sleeping. Option D. Saquinavir can cause headache, nausea, diarrhea, and photosensitivity. Sirolimus, Rapamune, is prescribed to a post-renal transplantation client. Upon the review of the chart, the nurse expects which of the following laboratory results? Option A. Elevated serum potassium. Option B. Decreased cholesterol level. Option C. Elevated platelet count. Option D. Elevated triglyceride level. Right answer is Option D. Elevated triglyceride level. Sirolimus, Rapamune, raises cholesterol and triglyceride levels. This medication also causes a decrease in potassium and platelet count. A post-kidney transplant client went to the healthcare facility to ask the nurse regarding vaccinations while on tacrolimus, Prograf, a medication used to prevent organ rejection. Which of the following is an appropriate response of the nurse? Option A. Do not skip due doses of vaccination, for this can help in your treatment. Option B. You can have live vaccinations even without the approval of the physician. Option C. Influenza can happen anytime, so a flu vaccine is a must. Option D. Do not receive any live vaccinations while on this treatment. Right answer is Option D. Do not receive any live vaccinations while on this treatment. Tacrolimus may lower your body's resistance and the vaccine may not work as well, or the client may get the infection the vaccine is meant to prevent. A nurse is giving instructions to a client who is receiving mycophenolate methethyl, Celcept, and mycophenolic acid, Myfortic, After undergoing a heart transplant, the nurse tells the client to anticipate the following side effects, except Option A. Insomnia. Option B. Vomiting. Option C. Hypertension. Option D. Diarrhea. Right answer is Option A. Insomnia. These medications can cause diarrhea, vomiting, sepsis, back pain, neutropenia and hypertension. Amikacin is given to a client with E. coli infection. The nurse advises the client to report which of the following symptoms immediately? Option A. Muscle pain. Option B. Constipation. Option C. Fatigue. Option D. Hearing loss. Right answer is Option D. Hearing loss. Amikacin is an aminoglycoside. Side effects of this medication includes ototoxicity, hearing loss, confusion, disorientation, gastrointestinal irritation, palpitations, blood pressure changes and nephrotoxicity. Options A, B, and C are not related with the medication. A client went to the emergency room with complaints of abdominal pain, nausea, diarrhea and mucoid stools. Upon the interview of the nurse, the client stated that he is taking cefixime, Suprax, for the treatment of urinary tract infection. The nurse determines that the client is most likely suffering from Option A. Crohn's disease. Option B. Acute gastroenteritis. Option C. Acute appendicitis. Option D. Pseudomembranous colitis. Right answer is Option D. Pseudomembranous colitis. Pseudomembranous colitis, also called antibiotic-associated colitis or C. difficile colitis, is the inflammation of the colon associated with an overgrowth of the bacterium Clostridium difficile. This overgrowth of C. difficile is most often related to recent antibiotic use such as ampicillin, clindamycin, fluoroquinolones, and cephalosporins. Options A, B, and C may have the symptoms of the client but are not likely due to this case. Amphotericin B, Fungizone 4 is given to a client with aspergillosis, a fungal infection. In order to prevent its side effects, the nurse anticipates administering which of the following prior, except Option A. Hydrocortisone. Option B. Ketoconazole. Option C. Diphenhydramine. Option D. Meperidine. Right answer is Option B. Ketoconazole. Azole antifungals, e.g., ketoconazole, decreases the effectiveness of amphotericin B. Options A and C. Fever, shaking, chills, flushing, loss of appetite, dizziness, nausea, vomiting, headache, shortness of breath, or fast breathing may occur 1 to 3 hours after the infusion is started. Medications such as acetaminophen, diphenhydramine, corticosteroids such as hydrocortisone may be necessary to prevent these side effects. Option D. Meperidine, 25 to 50 mg 4, has been shown in some patients to decrease the duration of shaking, chills and fever that may accompany the infusion of amphotericin B. A nurse is giving instructions to a client taking ciprofloxacin, Cipro, for the treatment of gonorrhea. The nurse tells the client to Option A. Report any history of tendon problems. Option B. Resume daily exercise such as biking. Option C. Take an antacid 30 minutes prior. Option D. Take it with the yogurt as part of the treatment. Right answer is Option A. Report any history of tendon problems. Ciprofloxacin may cause swelling or tearing of a tendon, the fiber that connects bones to muscles in the body, especially in the Achilles tendon of the heel. This can happen during treatment or up to several months after the client stopped taking ciprofloxacin. Option B. This medication can cause dizziness, so avoid any activity that requires alertness until the client is sure to perform such activities safely. Option C. Take ciprofloxacin at least 2 hours before or 6 hours after taking an antacid. Option D. Eating dairy products such as yogurt will impair the effectiveness of ciprofloxacin. Thanks for watching. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.